Okay,
This conference will now be recorded.
so good morning. My name is Gina Stone, and this is a PHAB meeting for the and we the couple of things. If Tammy, I believe, have written in the chat box for media any other questions that you may have. She has directed people to the right places. So if you have questions, just check the chat box. And you will be directed to the right appropriate places and persons to answer your questions. And first thing we're going to do is we're going to call roll to make sure that everyone that we need are here this morning. Steve Bennett. Awesome, I see Steve. And Barry, I heard, was possibly a maybe, and I still don't see Barry. Sterling.
Present.
Okay, I see Sterling. Barbara. And just because I haven't seen Barbara in a very, very long time, I think I might just reach out to her after the meeting. Lindsay, yay, Lindsay, thanks for coming. Thanks for being here this morning. And Les, I saw Les. Hi, Les.
Here.
Okay,
Here.
awesome. And Leah, are you here this morning?
I am here.
Okay, I hear you. I'd love to see your face, but I hear you.
Still setting up my shop.
Okay, no problem, no problem. That's awesome. Okay, so and I'm going to remind everyone to mute your phones. And the first item is for us to. Did someone say something? Okay, so I'm sure everyone had a chance to look over our meeting minutes from July 2nd and August 4th. So I need to know, I need to get a motion on to pass. Can I get a?
I move that we approve the notes from the last two meetings.
And
Okay.
I'll second.
Okay, awesome. Are there any discussions or recommending changes of any sort? Okay, awesome. So then can I get a yay or nay? Steve? Okay, I see thumbs up. Barry's not here. Sterling?
Yes.
Yes. Barbara's not here. Lindsay? Okay, I saw thumbs up. And Les?
Yes.
Okay. Leah, can you give us a voice? Yes, no? Yay,
Yes.
nay?
Yes.
Okay, awesome. And the minute passes. And I also vote yay, so it approved. Before we go on to our next agendas, all the things on the docket today, what I just want to recognize is I gotten few emails, voices from the public, and I don't want to go into all of it, but just basically give you guys a summary or acknowledge that there's a pretty big vocal request from our community, Whatcom County, requesting for a declaration of racism as a public health crisis. And I don't think any of us would disagree, I should say, with that. So I think we have made it a priority, and we as not just our community, but PHAB have been and will be moving forward with the struggle with that issue. So I just want to acknowledge that we did hear the public comments and their concern. Okay, so is there any comments or question about that from any of the members? Okay, so then the first item is a COVID-19 response update from our beloved Erica. Good morning.
Good morning, everyone. I'm not sure what to share with you because I know a lot of you are working very closely with us on all of our different initiatives. And I do see that, Cindy is with us, Greg is with us, John is with us, and actually Steve Bennett on the PHAB is with us on a number of our major initiatives. So we are working with Dr. Bennett on a social marketing, on the formative research for a social marketing campaign. And he, of course, can talk more about that. John Wolpers has been instrumental, along with our nursing supervisor, Lynn Pitzinger, in getting our mobile testing sites up and running in the last few weeks. So he could certainly answer questions about that. Dr. Stern has been working very closely with school superintendents, and as well as Cindy has been working with the community colleges, the technical college in Western, on school reopening and collaboration. So there's a lot that we're doing in preparation for the fall, for thinking about students going back or not going back and what that looks like. And that's really been a focus as we have been able to continue to get a handle on our case rates. We have seen over the last few weeks that they have dropped from their peak, and we're using that opportunity to try to do some planning and thinking about how we prepare for the fall, and how we work with younger populations and get kids back to school safely. So just a few things we're thinking about and working on right now, but my colleagues are well equipped to answer any questions you have about any of those things.
Anyone have any questions for Erica or anybody else? Well, from me, I just want to say it has been amazing watching the health department work with this pandemic, with this crisis. I know a lot of you guys have been involved with the task force and many other areas, and just looking at our numbers in Whatcom County compared to just all the other places, rest of the country, we are really, I mean, we're not perfect, but we are definitely in a really good place. And I think that is definitely a statement of hard work and a lot of thoughtful process that had been able to move on because of Greg, Dr. Stern, and Astrid, and Erica, and everyone, Cindy. I mean, I can't go on and name everyone, John. You guys have just been amazing, working around the clock, given all the shortcomings and restrictions that have been given to you guys. So I just want to give you guys a big hand and a big thank you for doing really a good job. Whatcom County isn't perfect. We have a lot to work on, but I think you guys have done a really good job. So we're not as bad as other places, but that's really an understatement. I think we're really in a good place because we have a lot of good people. Go ahead, Leah.
I just perused the agenda, so I wanted to check and see if it was there. But for me, the elephant in the room is going to be around schools and how are you interacting and working with our school districts?
Well, I can address that. We've been working closely with the 7 public school district superintendents from back in July when they were planning to open schools in the fall, and they asked for our recommendations and projections. And that's when I had written a letter recommending remote learning with limiting in-person stuff to support services for students. At that time, our infection rate was heading upwards. We were, I think, at went from 50 to 60 in a week, and it looked like we were heading over the 75 threshold that was part of the draft plan from DOH. So we've been communicating very closely. They needed some projections and recommendations on not just how to open schools, but whether to open them to in-person learning. And so we provided that. Just recently updated the letter to incorporate the published guidelines from DOH. And we continue to work with them on planning for kind of phased in-person learning. We have two staff that are working as technical assistants, as well as a school and child care response team for cases and outbreak response. And they working with their colleagues within local health and with DOH. So it's tight communication. I'm not quite sure if that's what. Do you have any more specific questions about that, or is that what you were wanting to know? I think there's been questions about whether we unilaterally make decisions about school opening, and I just want to clarify.
Oh, no.
Not from you, but from other people that we've gotten letters. And I just want to say our role is providing some of the epidemiology, some of that forecasting, so they can do their planning, and technical assistance. And in terms of requirements, that's state law, labor and industry. And should there be outbreaks or cases, that's when the health department would step in. There's an imminent public health threat, that we would have the authority to close schools or close classes. But I think there may be some questions about what our role is in school opening, and at this point it's really technical assistance and consultation.
No, that answers my question. Again, I have a very clear understanding of what your role is.
Oh, good.
And what it takes to open, and nobody was there in July. The numbers are not looking pretty at all. So you answered my question quite thoroughly. I don't know if anybody else has another.
So Greg, are there any specific like big benchmark measurements that we're looking for in order to guide the schools for next semester? I know for public schools for this semester, it's all remote, but for next semester, the decision has to come down, but are there specific things that you're following?
If you were to, I'd refer you to this DOH decision tree that's published. It's referenced in the letter that I updated, with updated recommendations. And in that decision tree, you're looking at, first of all, the transmission rate in the community. And if the transmission rate is projected to be in a moderate range or a low range, then there's a lot of room for the schools to work on plans to safely provide remote and in-person learning, hybrid services. There's also a question about the capacity of the health department to work to do testing and case and contact investigation in case there's outbreaks, and that schools have plans for how they're going to be responding to cases and outbreaks. So there's not one specific threshold, but all those interacting pieces are spelled out in the guidance.
Okay. Anyone have any other questions for anybody? Okay. So then the next item on the agenda is COVID-19 employer task force update. So I'm going to give the floor to Sterling to give us a update presentation summary.
Thank you. Yeah, this is a brief summary of what we've done, because we're winding down some parts and some parts. Okay. Can everybody hear me okay? So, just this past March, which was only less than 6 months ago, COVID-19 kind of crept into Whatcom County and laid siege to us over a series of days and weeks. It became obvious that we were going to have, especially from the state level, that we were going to have to shut things down for a while. A lot of fear and uncertainty, of course, about what was going to happen, because this wasn't like a typical disaster where, like a hurricane or earthquake, where we rebuild things. The path forward was really uncertain. And, really boiled down to how are we going to live and work together safely? How are we going to get that back on track? We had all this stuff about economic recovery, but public safety was a new thing for people. And there were very different needs. The needs of a manufacturing plant are very different than a restaurant or a store. So the health department asked the Public Health Advisory Board to look into what could be done, and we eventually formed a subcommittee task force in early comprised of PHAB and public and health department, and we were assisted by the consultants Holly O'Neill, Marty Solomon, and Laura Todd. So thank you very much to them. So we drafted a resolution that allowed us to form a task force that was passed by the county health board, and then we asked for interest from the business community of Whatcom County about joining that task force. We had 140 responses, which was pretty good. We were representing 18 different business sectors. We sent all of them a pre-test survey, I guess you'd say, of asking them to tell us about what questions they had or any challenges that they were facing and any barriers that they knew they needed to overcome in order to continue to do business or reopen their business safely. So we ended up deciding that all the people that applied were going to participate in this task force. We identified a couple, sometimes three liaisons within each sector to kind of lead what was going to happen next. They got those liaisons with the help of the consultants, got together some peer-to-peer sessions where they shared experiences and concerns while also starting a process of identifying what was specific about their sector that they needed to address for safety precautions. Gathering all the information from the CDC, the Department of Health, Labor and Industries, health departments. We hosted 4 forums about very specific questions that the business community could all attend. The one was, let's talk about masks. Another one was my employer has symptoms, what now? Another one was, how do we support employees during the stress of COVID-19? And then the last one was, how do we connect with young employees about COVID-19? One of the biggest things that we did was initiated the Safer, Stronger Together campaign, which is ongoing. Thank you, Steve, and all those who had to do with that. We did the whatcomtogether.org, is it .org or .com? Where we gathered some of the sector guidance. We built a way for them to get materials to show that their commitment to Safer, Stronger Together. And it was a place where they could come back to get any updates as they happen. And we did what we call this, I don't know if it was the right word, but a celebration on August 13th, where we agreed that we'd really finished a lot of our work and sent out a post survey that showed that identified some of the progress and some of the work that's left. We're still phase 2. There are a lot of places that aren't open at all, and there's work left to be done on that. The Safer, Stronger Together campaign is ongoing, and there's other works that are going about how to keep people updated and engaged in public safety. And that's my update.
Thank you, Sterling. I'm sure everybody's aware, but the task force was created in a huge, in a flash, and the task force did an amazing job in a really, really short period of time. But that's what we asked of the task members. And I personally feel like the task force did an amazing job, accomplished some amazing things. And every one of you that were involved, I think, did a phenomenal job to really guide and direct the Whatcom County and the businesses and public at large to feel safer about coming back out on interactions. And so I was just completely amazed by what the task force was able to accomplish. But I do have to say, I could be completely wrong, but I think this might have been Erica's brainchild, because it all kind of came about when Erica started, this pandemic hit, and then we were asked to do this. So I may be just making a temporal association, but I just wanted to give Erica a big thank you for coming up with such a great idea. Anybody else have any questions or comments for Sterling or Erica?
I just want to thank all of you for I know it was hundreds of hours that you volunteered to work on the Employer Support Task Force. So thank you to all of you. I saw you every week for hours on calls, and I know you were putting in a lot of time outside those meetings as well. So thank you for your leadership in moving it forward.
Okay, so we have a pretty robust agenda, so I'm trying to kind of move us along. So if there's no other questions or comments, I'm going to move on to our next item, and that is Child and Family Action Plan Ordinance Update. So Sterling and Astrid will help me kind of go through this part, but just to kind of give a brief update. On February 4th of earlier this year, the Health Board, which is a county council, adopted the Child and Family Action Plan. And it was the action plan was a culmination of years and years of hard work from a lot of people. And the draft of the ordinance of establishing the task force presented when we had our special meeting in August earlier, just last month. It's like time's kind of a weird thing at this point for me. It's like it expands, and but the last special meeting seems like it was a long time ago, but it was just in August. But the thing, and I'm sure it's within the package, and we had discussed it last time we had met, but we've made some changes. And so I hope everyone had a chance to look at it. The timeline was kind of what we really needed to talk about to move the ordinance forward. But Astrid and Erica also had, I thought, kind of a brilliance of an idea of kind of adding onto in order to move this forward. So I would love to hear, I would love for Astrid and or Erica to kind of to speak to that.
Will I turn on mine? So just for the good of the audience, Astrid Newell, I'm the Community Health Manager at the Health Department, and thank you, Tina. And so one of the, in putting together some of the edits for the ordinance, Erica and I did have a conversation with Executive Sidhu, and in the conversation, he is very supportive of this work, and was interested in a way for the task force to report to him as the executive. The way that the ordinance is structured currently in its draft form is as a advisory or a task force body that reports to the council. But he is very interested in having the task force connected to him in some way. And so that there were some potential edits from the executive office that were submitted kind of late. Simple, just adding the executive to the reporting structure. But I think that's to be discussed. And also, I don't think Barry Buchanan has had a chance to weigh in on that yet as the representative from the health board. So, but I'm just excited that the executive is really excited about this work and very supportive.
And if I can add, Astrid, part of the interest in having the task force report to the executive was that he, unlike the council, is in a position to be able to allocate staffing resources from other departments within the county to help get buy-in from other departments outside the health department. So functionally, that feels practical to be able to use those resources and have other staff involved as well. But I have not heard back from Councilmember Buchanan about his take on that.
I do believe, I think it was Tammy who kind of dug up the technicality of we still have to have the county council involved. But I think it is very, I don't want to, pragmatic may not be the right word, but it would be a more direct line to support the overall action of this work that this body has been doing for a number of years to move it forward. And not to say that exec has been an obstruction, but that has been kind of more of the bigger task to overcome, or that's, I'm not really using the right word, but I do feel like the exec office has more power to be helpful moving forward the work. And you know, whether we call it the office, whether we call it whatever, you know, the terminology isn't as important as the goal of the body of work. It's that we can't forget the work that we need to do for our children. And I feel like right now our PHAB is in a position as a group in this incredible political climate. I mean, we're looking at all of these racial issues that are bubbling up to the front. I mean, like they're just bubbling up. I mean, it's a natural process. And we've been working on, Sterling especially have been working on protection, health protection of immigrant families. And that has been, I don't see how you can tease those two apart. At the same time, you know, Sterling always likes to bring up the fact that children are number 3 and 4. By the time we get to priorities number 1 and 2, we forget priorities number 3 and 4, and that's our children. And with, you know, our children who we might forget right now, but in less than a generation, which is about 5 to 10 years, those are the people who's going to be the main stakeholders in our community. So if we don't take care of our children, and guess what? There's the problem or the issue of the race and you know, all the things that come with. So I don't see how we can tease any of these apart, and yet here we are. We're holding these really 3 important titanic waves like in our hands. So I don't know about you guys, but sometimes I'm just kind of overwhelmed and feel this huge responsibility to make sure that we are doing the right thing as a group, because we make recommendations and you know, those things get carried out. So Sterling, go ahead, Astrid.
I just wanted to clarify that you had mentioned that it was Erica and my suggestion, but it was actually came from the executive. I just because because he very much wanted to be be in support of the work. So I just want you to know that while we carried it forward, it was the executive who made the request.
Well, I guess I just meant that you guys were the ones who brought the news to us, was kind of what I meant. But yes, thank you for that clarification. Sterling?
So I was going to say something. This morning I said this yesterday. I'm old. I'm 66 years old. Maybe not as old as Greg. I don't know, Greg. I mean, you older than me. And there are two things that are happening this year that are unprecedented for me. First of all, I'm from Maine, and I was born a Red Sox fan. This year, the Boston Red Sox are the worst they've ever been in my entire life. 66 years. Horrible. And the other one that this year, we passed this resolution about Child and Family Action Plan. This is the worst year in my lifetime on how children are going to be affected in a negative way. Families in particular, the younger children in particular, those that are disadvantaged in particular, the separation between the haves and the have-nots is just going to be cracked open. And so we can't wait while we figure all this out about the economy and all this, because children are being affected now. And like Chena was saying, there's this intersectionality, this grand overlap between these three big things that we're doing, the health protections for immigrant families, the Child and Family Action Plan, and then what we're just going to talk about, the racism as a public health crisis. And children are the ones that are getting the most damaged by this. And this year is just unprecedented in how this is all going to happen. And so I just want us to keep pushing forward, to keep asking for things to happen at the county level, at the executive level, because now more than ever, this is a real disaster for families.
So my specific question from the PHAB members this morning is, could we look at the timeline within the ordinance? It's on page 9. Can you? It seems I've kind of given the task force about 2 years time to kind of get the job done, but do we feel like we need to shorten that a bit? Any thoughts on that? Do you guys then mind if Sterling and I think it was Leah, Sterling, Steve, the four of us had worked on the ordinance. So are you guys okay if we just got together and just kind of came up with a more shorter time period to get through the task of the task force? Astrid, what do you think? Is 2 years too long? Should we make it a little bit shorter to kind of get our goals achieved?
2 years is too long and too short. It's kind of yeah. I think that it looks like the first date is June 1st of 2021. So that's by the time this is passed and the task force is established, it will probably be about 6 months or so that that the group has any chance to do anything. So
right.
So it feels like, and there's quite a bit in that phase 1 that was put into that phase 1. So
right.
So that feels pretty. I think that there's a real sense of urgency here. So that is important to think about. But it feels like having that first stays done by that June date is still a fairly ambitious.
Daunting.
It's an ambitious timeline already.
Yeah.
In terms of the other two, it's a little bit harder to tell. But certainly you could talk about making that faster. There are things that take time, but we also recognize that the community and families want to see movement quickly.
Okay. Well, since we have to make a little adjustments to make it more appropriate for the executive office, are we okay just kind of talking about it in a smaller group so we're not taking up too much more time within this meeting? Are you guys okay with that? Members? Lindsay? Are you okay with that? Okay, Leah, I can't see you, but are you okay with that? Okay, Steve?
Sheena, can I just ask Tammy, is there a formal endorsement or motion or vote that needs to occur by the PHAB in this meeting?
If the ordinance is pretty much at the point where it's ready to move to the review by the health board and council, then it would be good to have a motion and vote to say, yes, we do want to move this forward. And of course, these are always subject to changes by those bodies. So if you're not ready with the timeline and want to make some changes, you could, probably the only way to do it without coming back to a meeting would be to say subject to changes to the timeline. But everybody has to be in agreement that whatever changes you guys make are okay with or without knowing those. Does that make sense?
Yes, that's actually what I was trying to say. Probably didn't verbalize it as well as Tammy just did. And so the members who were involved in editing or working on this ordinance were Leah, Steve, Sterling, and myself. So Lindsay, do you want to be involved with it as well?
So I guess I feel like there's been so much community support of this measure. And so just how, is this a timeline that's been passed through the group that's been working on this for so long?
Timeline actually, it was the last thing that we've worked on. We've been working on the wording of the ordinance, and the timeline was kind of like what we've been kind of trying to deal with. What was, what is appropriate time? It's kind of hard to tell. So that's really the only part we need to work on, and some little bit of wording before we bring it back to move it forward to exec and to health board. Yes, Greg.
Yeah, just one caveat. A lot of the work has to do with identifying funding streams in terms of the report. A lot of this is fiscal. And given the uncertainty, I'd discourage you from ramping things up faster. You can certainly do it sooner. But by doing it quickly, you may end up making plans that aren't going to be supportable given the instability in the economy. So I just want to make sure there's
Duly noted. Yes, there's.
Yeah.
Go ahead. Thanks. Go ahead, Steve.
I just wanted to add, it seems like the conversation is mainly leaning to whether or not people want to move some of the timelines up, especially on points 2 and 3. But the wording in there says no later than, meaning that I think that already leaves us the option once it's kind of put in to move those timelines up. So I think the wording actually allows us to play with those timelines and move them up later if need be, even if passed with the wording that it has. So I think that the document actually allows us a little bit of freedom to move timelines up.
Okay. So for PHAB members, are you guys okay with that? I think we do have to make minor adjustments, wording to send it to exec office. But are you guys okay with that? And then we can bring it back for moving it forward after we do those final editing. Yes, Sterling, I saw your hand go up. Okay, all right. Steve, you're okay? Lindsay, are you okay with that? Okay. Leah, I don't see Leah. She was here.
I'm here. I'm okay.
Okay. Are you okay with that?
Yes,
Okay.
I'm okay with that.
Tammy, did I get everybody? I mean, I don't think we really needed a vote for that, right?
You know, if you're bringing it back, no. If you do want to just begin to move it forward and start the process, I would recommend a vote and just include that, like keep it a little bit general, keep the motion a little bit general, saying that you will be making amendments to the language to include the executive and yeah, whatever other possible changes you're thinking might be in there. Everyone sounds like they're okay with it. I agree with Steve about the timeline. You're already covered with that. So our next meeting, we have a health board meeting in October and a joint meeting, hopefully the same day. And then the next PHAB meeting is not till November. So we do need to get the ordinance through legal and things like that. So my recommendation, if you can, is to do a motion today, take a vote on moving it forward, subject to those changes.
I will move that we send this ordinance forward, that we agree that there may be minor revisions to the wording of it pending input from the county executive.
Awesome. Do I have a second?
I'll second that.
Okay, great. Okay, any further discussions or recommendations for changes? Okay, so Sterling, yay or nay?
Yes.
Okay. Lindsay, yay or nay?
Yay.
Steve, yay or nay?
Yay.
Leah, yay or nay?
Yay.
Okay, and my vote is also yay. So motion passes. So the next item on the list is update on addressing racism. So Erica and Astrid will be taking over this part. But before you guys do, I just want to throw something in there just for like 2 minutes, only because Leah, Steve, and Sterling, I would just want to acknowledge their time and their work. They, you know, we had a conversation with Sheriff Elfo, and although it wasn't directly about addressing racism, it had a lot to do with protection of immigrant families. And what I would like to do is I feel like it was a really good conversation, and I'm sure if we got everyone to talk about it, you know, we can have a more robust discussion, but we don't have time for that today. But he did, the sheriff came up with kind of few requests for PHAB to put our heads together and give him recommendations. He was very open to listening to what we had to say. Like this is like he asked for what other mechanisms could he use to you know to include advocacy group and things of that sort. He had 3 very specific requests from PHAB. So Tammy, what would be the correct, proper way of circulating the questions and gathering people's ideas to but to forward it to the sheriff?
We can send out the questions, no problem. I can send them to everybody if you get them to me.
Okay.
As far as responding, we can't do a reply all because that would be, and discuss it, that would be conducting business, but they can be sent to me. I can gather them and send them again for review, either in a packet or to review again, but not for discussion or decision.
And then I guess maybe in October when we meet, we can discuss it, agree, and then move forward to pass it on to the sheriff. Would that be the way to go?
Well, the October 6th meetings both involve the health board. So if that's something you want to discuss there, that would work. Otherwise, it's November 5th.
Okay. So, so are you guys okay with that, Sterling, Steve, Leah? Because I don't want the work that we did with the sheriff to not go forward, because I do feel like that was a very productive meeting. So I'll forward the questions to Tammy, and then she can, circulate it, and then you guys can email her with ideas, and then we can kind of discuss it as a whole in October. Would that be okay? Okay, awesome. All right, so I will do that, and then I'm going to open the floor for to Erica and Astrid to give us update on the racism. Problem solved today.
Oh, if only. So I'll let Astrid jump in, please, whenever I've missed something, and add to whatever you'd like. So at our last special meeting, we talked about a couple of deliverables, and we have those deliverables for you. The first is a resolution to pass forward to the health board that would declare a racism a public health crisis. And I drafted a resolution for your perusal. It is on page 13 and 14, and open to your suggestions and edits. The second deliverable that you requested was a letter to Executive Sidhu requesting that he enroll the county as a whole in the Government Alliance on Race and Equity as a core member. So that would include not just the health department, but all departments within Whatcom County. So that is also, that is on page 15 in the packet for your perusal as well.
Did everyone have a chance to kind of look through that? And I don't know if you guys know, the Bellingham Herald had a really excellent article interview with Erica on this particular topic. And it was a really long article, but it was written really well. And I believe Denver is here. Yeah, she's still here. And I believe it was Denver who wrote the article. And it goes over. The article talks about this this ordinance. And if you guys had a chance to look at it, it's pretty impressive what Erica was able to pull together with Astrid, and it's very encompassing historically, and as well as all the different aspects of our society that the racism affects, and the profound effect that it has on each and every one of us. Probably, I imagine Astrid also has something to do with this as well. And Astrid, did you want to speak to that?
Thank you, Gina. Yeah, I guess maybe I'll step back just a little bit, and I just want to say just the appreciation for this group in looking at this issue. We all know that issues around racism and race are really difficult topics to dive into. They're deeply personal. They also, they require looking at our institutions and our community, as well as really looking in personally, doing some self-reflection and entering these conversations with a large measure of humility. As we're all in different places in our journey of thinking about racism and our own experiences, and grappling with issues of privilege, and so I think I just want to acknowledge that this this is hard work. It's important work that we dive into, but it is difficult work and will require not only us learning more about experiences and ways forward from our community, from people of color who are experiencing challenges, but also looking really closely at our policies and practices within county government, within our community. So I just want to acknowledge that this is a step forward in terms of acknowledging the issues. And as Erica so eloquently stated, that this is the easy thing to move this forward, move a resolution forward, and the harder work begins as we have the discussions, as we learn more about what we need to do and make the changes that are needed.
In many ways, though, I feel like acknowledgement is the hardest part, because work cannot begin being done without the start, the beginning, and the beginning can't be there without the acknowledgement. So, you know, I know that work will be very hard, even after the acknowledgements, and then the real work really begins, and I totally get it. But I at the same time, I do feel like this acknowledgement is momentous in our history. Historically speaking, it cannot happen without this acknowledgement. And so I do feel like this ordinance is really, really super important. And, you know, we live in Whatcom County, which I moved here a long time ago to raise my family because it was a safe and great place. But we have our shortcomings. I mean, even when we look at our screens today, you know, it's rather homogenous. And so it's easy to forget living in this community. So, you know, just that mere acknowledgement, I think, is so important specifically for that reason. And the other thing that I was thinking about was, it was so important to have Barbara's voice when she was coming. And I don't know if you remember, Sterling, I don't know if Barbara was coming when you joined initially, but you know, she brought the you know, perspective from being the Native Americans, and she, you know, she said things that a lot of times most of us didn't think of. And so, and her absence, in my opinion, is very much felt. And so I think it's important for us to maybe reach out to her, and if she's unable for various reasons, get somebody else that can give us that voice, so that this work that we're doing, particularly right now, brings that importance, having that voice in the PHAB.
Thank you, Gina.
Go ahead, Steve, and then Astrid.
Yeah, similarly to that point, I had some questions of discussion about the resolution, if it's possible to talk about that right now. And I don't have the answer, but I think that it's a worthwhile discussion. I think Native communities are only mentioned once in the entire resolution. And I think Latinx or immigrants are mentioned maybe 2 or 3 times. And I think that while there are some, for lack of a better word, bullets or sections that are specific to the Black American experience, I think some of the bullets are also highly relevant for the Native American population and immigrant communities, especially some of the first few, such as where it says, we're out throughout the history of the United States, systemic racism has manifested by acts of discrimination and oppression towards immigrant populations and disproportionately towards Black Americans. I think that I would be hard pressed to say that Native populations shouldn't be included in that statement. And then there's a couple other statements in there where I think it might be worthwhile looking at when we are specifically talking about the Black experience and when we're talking about immigrant, Native, and Black experiences.
Okay. Good point. Go ahead, Astrid and then Les.
I'll hold my comment until the board has the chance to.
Okay, go ahead, Les.
I'm fully supportive of our resolution, but I'd like to point out that our society is at a crossroads, and it goes beyond this crisis. We want to make sure that this doesn't give some people a chance just to point a finger at the police. This is a moment to look in the mirror at ourselves. Each of us have prejudice. It's human nature, and we each need to do better. So it's right to have a nonviolent demonstration. It's right to have this constructive dialogue. The next step is meaningful legislation to make change and to self-reflect. Personally look in the mirror. How can I be better to be better with my prejudice to my fellow man? And I think we're starting that dialogue, but this isn't, I want to make sure that this doesn't get people off the hook, and we don't let this be finger pointing. This is more reflecting and looking in the mirror. And I think we're all doing that here, but I don't want it to stop here. This doesn't get anybody that writes us a letter off the hook. We need to keep going. Thank you.
Thanks, Les. You always say very poignant points. Go ahead, Greg.
I think Astrid, if you want, I think you were waiting, but I make a brief point.
No, go for the.
Yeah, I think one thing to consider when we're doing these resolutions, there's a lot of self-reflection and personal behavior that's important to address, but as public health advisory board, as a county health board, as county government, our job is to lower barriers, to identify barriers to justice, and to say what can we do collectively to increase just allocation of resources, to recognize the impact of poverty and discrimination, to understand the historic trends and how to mitigate those. And that's a real important goal in setting policy, because we're stewards of public resources, and we determine, as I'm doing this in general, as government and as a citizen advisory group, that's our primary kind of role and responsibility. So I want to make sure we're focusing on that. In addition to pointing out the importance of all these being personal decisions and challenges too.
Okay. Go ahead, Astrid.
I was just going to come back to the high-level agenda items, which are just the reviewing the updated draft resolution and the draft letter to county executive, and just wanting to make sure that that people are clear about what's in what we're asking, what the resolution is asking the health board to do, and as well as what is incorporated into the letter in terms of specifics. And I know that there are a number of people, public on the phone, on the call today. So just calling out that that specifically the resolution is calling out the health board to commit to actively participating in the dismantling of remnants of racism in Whatcom County. And then there's a listing bullets around implementing annual training, assessing and revising county departments, policies, procedures, and ordinances to ensure racial equity and transparency, ensuring that hiring practices provide greater opportunities for people of color to be employed to further diversify our workforce, ensuring diversity of race, age, and gender within county commissions, and supporting community efforts to amplify issues of racism and actively engaging with communities of color. and building and strengthening alliances with other organizations that are confronting racism, including county membership in the Government Alliance on Race and Equity, which is also called GARE. So those are the, I just wanted to call out that those are the main action items, and wanted to make sure that folks have had a chance to look at those and any specific comments on those actions. And then within the letter to executives to do, you are asking again to do to advance the resolution as well as the Government Alliance on Race and Equity membership. So just for clarity of what the actions are within those two documents.
Anybody else have any discussion? Go ahead, Leah.
I wanted to inquire on the inclusion, not that I disagree with it, but how did age and gender become a part of that bullet point around commissions?
Are you speaking to the fact that there is lack of attention to age and gender?
Well, no, I'm speaking to the fact that this is a resolution on racism. And I don't want to, I want it to focus on racism. And while age and gender are issues definitely within our commissions and other positions of leadership and power within the county, this one was focused on racism. So I'm wondering what was
on bullet point D, is that what you're talking about?
Yes.
Yes.
Just for a bit of background, I looked at resolutions passed by jurisdictions all over the country, and I pulled good bits from each of them. So that was included, I believe, in the city of Denver's resolution, and it wasn't necessarily me intentionally adding those words, so I'm not wedded to them.
Yeah, I agree with Leah. I think that might dilute what we're trying to focus on racism. Go ahead, Sterling.
There, except to acknowledge maybe there's a kind of intersectionality between gender and racism that makes things even worse for women and
for children
and children. And so that's the part that I wouldn't want to leave out, is that some groups are being more affected by it than other groups, and women in particular would be something that we shouldn't forget.
But we can definitely change the wording on that, because you know, to say that age and gender discrimination can be worsened in the lens, if you're looking at the lens with the racial injustice. I mean, would that be okay, Erica, to kind of change the wording on that, to put emphasis on how racism makes the you know, sexual discrimination as well as you know, affecting children?
I'm open to whatever the group is
Yeah.
in alignment around.
Just to the children point, I don't think children really apply to that point, because it's talking about diversity within county commissions. So it sounds more like it's hiring practices.
Right. I would prefer to focus on racism and for now leave out the intersection of gender and age.
Leah's convinced me. I agree.
Go ahead, Steve.
I had one question. I don't have the answer for it. But one of the things that we know specifically within the realm of public health as well is that access to consistent and culturally appropriate healthcare and quality healthcare, especially from we have evidence now that getting healthcare from people who are part of your community increases outcomes. And so, is there something that we can add about culturally appropriate healthcare, consistent quality access to healthcare, and preventative care as well within this situation? Because we've already really strong evidence that mortality within Black populations is greatly decreased when they are able to access Black doctors, and we've seen similar evidence within Latinx communities where culturally appropriate care, language, things like that are really important in health outcomes. And so I think to completely miss that realm might be a disservice.
I think we could definitely add that in there. Would that be, we could do that, right, Astrid? Erica? Yeah.
Yeah, I think we're just kind of clarifying where that would go, just kind of, and just thinking about this. This is a health board resolution. So we're asking the health board to, or the group is asking the health board to make some commitments. And so just thinking in that frame of how of what the action would be specifically for that from the health board perspective, where that would fit. So
yeah, no, I hear that.
Yeah, if you have some thoughts on where how to what the action might be for the health board.
Not yet.
Okay.
Okay, go ahead, Leah. Go ahead, Leah.
I think it falls quite nicely into the hiring practices. And I know the literature, it's supported in the literature around healthcare, but I would say it applies to all of the work that we do at a county level to a certain extent. Is that the more familiar faces you can see when you're receiving services, especially as a person of color, the more fluid that transaction can become. So I think it would fall nicely into the hiring practices section.
Much of the whereas statements are kind of deficit or negative statements, and there could be a statement about that as well within the whereas statements.
I think that would be really good there as well too. Yeah, thank you, Erica.
Okay.
Yeah.
There's an allusion to it when we talk about asthma and a couple other health outcomes that I think could be tied to that, and maybe we can put it around that area.
Yeah. So we'll add the healthcare that is culturally and racially appropriate care, and putting more emphasis on race rather than age and gender within the county commissions, and we'll make those changes or edits to the resolution. Are you guys okay with that, or do you have other points? Sterling, are you okay with those two edits? Okay. Steve, are you okay with those two edits? Leah? Lindsay, do you want to add anything else? You're okay with those two edits? Okay. So Tammy, what would be the appropriate protocol to follow?
Well, you were unconsciously following it. So you just need a motion asking if everyone's okay with those two. Well, you've asked if they're okay. So summarize your motion, including those two edits,
Okay.
and vote to approve or, yeah, to approve.
Okay, so the motion is to add within the whereas parts of the ordinance, healthcare that is racially and culturally appropriate practices, and secondly, ensuring putting emphasis on the race rather than a race with age and gender within the community, within the county commission. So can I have a motion for those two edits within this ordinance? Oh, yes, Astrid. Yes.
I think we had also had some discussion earlier about adding
Yes.
more whereas around our indigenous populations and
yes. Yes, and then the third edit is to edit our indigenous population where there are words of Black people, and we should also add Latinx as well, right? Yes.
Can we go, because if we get into the naming specific groups, then my fear is that we're going to leave someone out. And is it okay to say people of color?
I like that better. That way we're more inclusive. But I do feel like we need to specifically mention the indigenous people in addition to colored. Is my perception kind of wrong on that? Or if we just left it as colored population, does that include everyone?
Well, let's definitely say people of color, and not colored. And I don't know. I feel like we would need somebody with lived experience as being an indigenous person to tell us that.
I am colored, but I'm not indigenous, so I don't know how that feeling would go.
I would hate to say yes or no when it's not my lived experience.
Anybody have any better experience? Because I do think that we need to add that wording in there, but I don't know what the appropriate way to do it is. Anybody have any idea how we go about it? Go
I
ahead.
don't know. We can check in with someone. It seems like if we talk about people of color, but then specifically maybe follow up and mentioning immigrant and indigenous communities, because there are specific legalities that impact those communities as well. That might be a possible way to do that.
I actually like that. If we say people of color / immigrant and indigenous communities, that way we're including everyone. Astrid, go ahead.
I was just going to suggest that instead of following up with Leah, that maybe there's an opportunity to do a consultation to make sure that the language is appropriate. I know that there's a number of things now. Oops, I'm having technology challenges. The use of the terminology Black, Indigenous, and people of color, BIPOC, is fairly common right now, and so that is a common terminology. But I do feel like we've done this before with resolutions to do a little bit of consultation with to get the language right, because the language is important.
Yeah. Okay, so then, gosh, how do we pass this motion? Who would we be consulting then, Astrid? Is there a specific consultation that we need to do for the language before we can pass the motion? Or how would that go?
I would ask the board to, if that's of interest, to include that as one of your next steps, and the health department can certainly help you with finding those consultants.
Okay, sounds good. Okay, so then the motion is now, first of all, we will find consultants to help us with the wording of the naming of the populations, number one, and number two, not diluting race with age and gender within the county commission for hiring practices. And number three, to put emphasis on healthcare that is racially and culturally appropriate, and put that part within the whereases in the appropriate place where the healthcare is talked about. So can I get a motion for that, those three edits?
I move that we send this resolution on with the pending the consultation of the language, pending the removal of age and gender from the hiring practices, and pending the inclusion in the whereas that specifically addresses healthcare disparities.
Can I get a second?
I second.
Okay, thank you. Any further discussions or recommendations for changes? Okay, then yay or nay, Sterling?
Yay.
Lindsay?
Yay.
Steve?
Yay.
Leah?
Yay.
And I am also a yay, so that the motion passes. We are at 8:19 and we only have 10 minutes to talk about the planning for joint health board PHAB meeting in October. So
Tina,
I was
sorry to interrupt. We do have
Yes.
the letter to Executive Sadu to
Oh,
move
yes.
forward as well.
Yes. So okay, so then let's go back to the letter to Executive Sadu. Anybody have any comments, questions about the letter? Sterling?
No, I have no questions. I was just looking at it again one more time. I do move that we send this letter on to the executive.
Okay, can I get a second?
Second.
Okay, thanks, Leah. Any further discussions or changes? Okay. Sterling, yay or nay?
Yay.
Lindsay, yay or nay?
Yay.
Leah, yay or nay?
Yay.
Steve, yay or nay?
Yay.
Okay, and I am also a yay. So the motion passes to send the letter on to Executive Sadu. Okay, so that gives us 10 minutes to talk about the joint meetings. That was originally scheduled for 30 minutes, but we're going to do it in 10. So I was looking at last year's agenda for that joint meeting, and what I realized was this year looks very different than it did last year. You know, there were year in review, and then our priorities coming up, and then we talk about roadmap up ahead. That's kind of the bigger structure of how the meeting should go. But I want to hear from our members your thoughts as to what you would like to accomplish, ultimately achieve out of the meeting. Because this is one time in a year that we can really talk to the council members one-on-one, and it's an extraordinary opportunity. So I think there's an opportunity for closer personal relationship. And you know, we're now meeting in a Zoom, so everybody's kind of on this little screens, but it used to be where they're sitting up there and we're sitting down here. You know, we have to like almost present to, you know, the court. And so when you're, you know, sitting at a table one-on-one and you're having a conversation, it changes the dynamic quite a bit. And then, you know, when you see them anywhere up on the, you know, on the podium or, you know, sitting next to you, the relationship changes because you know them. So I think the personal relationship is important out of those meetings. But I'd love to hear what everyone else would like to get out of the joint meeting. Go ahead, Sterling.
I was going to say this is also an actual health board meeting day too at the same time. We're doing two things at once. So I just want to confirm that.
Tammy?
That is what the clerk of the council requested. It was the only day that they had. But we can determine whether we need the hour-and-a-half and a 3-hour meeting, or if the health board joint meeting, one of the two meetings can be shorter, or if we want to combine them. So recommendations for that are also welcome.
One of the things I guess I'd say is that I don't think in the 7 minutes that we have left that we don't have enough time to do both of those things, especially for planning for a formal presentation for the health board for some of the things that we want to accomplish, especially a child and family action plan, where there are things left undone that we need to kind of press them on. So is it possible to have another short meeting about this that we could put together, or how? I mean, that's just my thoughts about it. I don't want to go into this unprepared. We have it's important, two important meetings.
We can try to pull a meeting together. I can pull the group, or you can have a subcommittee to work on it and bring ideas to the larger group if that might be more expedient. It's up to you.
Can I suggest a special meeting with the PHAB members just I mean, it has to be pretty soon because October's coming up around the corner. So I know everyone is super busy, but can I ask the members to do that? Would that be possible?
Yeah.
Okay. Thumbs up on Sterling, Steve, Lindsay.
Like next
And I
week.
have to say, it's been really hard for me to make extra meetings with my new promotion. And so I just want to put that out there that I've had a lot of time conflicts. So
Okay.
I will definitely make my best effort.
No, we are completely happy if you can make it. So are there particular dates that work out better for you? If you can like shoot that to us, then you know, let us know, and that way we can work around your schedule. And because we definitely would like to hear your voice and have you be there with us. Leah, are you okay with that? Another meeting? Okay. So Tammy, I think the members would like for you to arrange us a special time or special meeting just to discuss the agenda.
Okay, I will send something around.
Okay. And we need to have Erica in that meeting as well, right? Tammy?
Yeah, that would be a really good idea.
Yeah.
I'd like to join you.
Okay, thank you. So then that does then give us 5 minutes to talk about the meeting evaluation. I personally feel like every single one of our meetings have just been full, robust, just bursting at the seams. We have so much to talk about, and I don't know that I'm always getting to everyone who wants to speak, but the topics themselves are just really full, and so I hope I'm being thoughtful enough to give everyone a chance to speak. But anyway, I'd love to hear from everyone. Sterling, what do you think?
Yeah, that jam-packed thing, and these are not small topics that we're tackling. When I started, you know, PHAB almost 2 years ago, it was like, it seemed a little easier then. It was kind of relaxed. And now things have gotten more, there's more at stake now. And so we did really rather well. We just ran out of time for that one prep thing, which we need to do. Other than that, it was great. Just can't do it in an hour and a half.
Thank you, Sterling. Kathleen?
I just want to say I really appreciate the leadership of this group and just the rich discussion and thoughtfulness that goes into moving things forward. So just really appreciating this group.
Erica?
I'll echo Kathleen. I appreciate the leadership and the partnership. We as health department staff feel very supported by the PHAB, rely on your expertise in areas that we don't possess, and feel as though this is a great opportunity for us to really tackle difficult issues together. And thank you for taking all of these really challenging issues on and working them through with us.
Thank you. John?
Well, I would echo both Kathleen and Erica and just say that the robust discussions that have gone on are truly amazing to me. The growth that has taken place in regards to the Public Health Advisory Board and the mission that you guys have taken on in all these different topics have just really greatly improved. It's just amazing to me. So again, I just want to reach out and thank you all for all the work that you're doing here at Whatcom County.
Thank you, John. Astrid? Okay, I'm not hearing Astrid. Greg? Dr. Stern?
Yeah.
Oh, go ahead.
I'm sorry, I'm hearing an echo. Yeah, I just appreciate the thoughtfulness and the work of the PHAB. I was just thinking how I started off in public health, being on this board. It's been almost 30 years, and it's really appreciated how it's evolved and become so much more effective and a partner in developing policy and stewards of partners and stewards of public health in this community. So
Thanks, Greg. Lindsay?
Yeah, so I would just say along the lines that we've had really packed agendas. I think that when we have the meetings with the health board, it would be one of the most useful things, I think, was the year in review. So just to kind of ground us in what's happened so far and where we're going in the future.
Mm-hmm. Yeah, I agree. Thank you. Steve?
Yeah, I think that the PHAB's been pretty awesome lately with the amount of work that they've been doing and what they've been doing. One thing that was put in kind of sharp relief for me today, I don't know if that's a phrase, is the idea that, and this is to echo what Gina said earlier today, but to put a bit of a finer point on it, and off of what Sterling said when talking about the racism issue today, which is that it involves a lot of self-reflection and self-evaluation. And I think that we need to apply that self-evaluation and self-reflection to the PHAB itself, as well as to who makes up the membership of the PHAB, and figure out what areas that even membership of the PHAB could focus on, and to include individuals to help represent our community even better.
Well said. Leah?
Agree. Action-packed, full agendas, and I could spend hours on each item, if not days. And so I really appreciate you moving us through the paces, but at the same time allowing for space for good conversation. I really want to, I didn't get a chance to thank Sterling for his comment, not about the Red Sox, but about the other thing in his life, which is that I agree, these are unprecedented times for children, and the issues that they are facing and going to face in the near future are something that we have never seen and are not going to see and are going to see the impacts of very soon. And I give kudos for him for bringing that up, because that is like on my mind. I feel like I'm screaming it, like the impact to our children because of what is happening now is going to be seen now and far into the future. And so kudos for us, and not kudos, but it's just such a timely thing that we have this resolution around children and families. And I would like to say that I think while focusing on the individual as it comes to racism is very important, I think us as a group really, our role is really to focus on the institution and the structures in place that support racism.
That support racial justice, not racism, right?
Correct.
Astrid, any evaluations for the meeting today?
Oh, I'm sorry. I'll let you all go. Thank you for the opportunity to be part of the group. I got kicked off the computer. My county computer decided to restart in the middle. So, thank you.
Okay. Thank you. So we're already 3 minutes over. There were 3 questions, and I'm not really sure how we're supposed to handle them, but I'll just read them off really quickly. How would person's racial identity be established? Who determines a person's race for these purposes? Who makes the determinations by what means? Those 3 questions were asked by EB. What she also, or he or she put up first question, your intention to identify persons by race and culture. The county has a non-discrimination policy. Your idea is that non-discrimination policy should be changed. Anyway, so those are questions, and I'm not, we don't obviously have time for them, but Tammy, if you can make sure that the members, the PHAB members, get copy of the questions, and so we can kind of maybe think about them and give our thoughts at some point, that would be great. Okay, well, we are 4 minutes over, so I'm going to say goodbye. The meeting is adjourned, and we will meet for the special meeting. And so when Tammy emails you guys with the request for dates, please let her know ASAP, and we'll get the agenda going for the joint meeting. Thank you.
Bye.